Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes recording a bit of speaking for you guys. So we haven't done a lot of speakings in this Zoom session because our candidates are getting it from the individual teachers. But today I would like to do a bit of this as you have asked me this question, and this is a different kind of a speaking because in this we are making a home visit. So that is what is different about this particular speaking, that you are making a home visit. So you are a community nurse visiting a patient with mild COPD, but recently he had a flare up. So that means condition got worse. So that is why so she was given an oxygen cylinder for the short burst therapy at home. The patient's GP, so that means patient GP has asked you, because you are a nurse, to check on the patient to see how she is coping with the cylinder. Greet the patient, introduce yourself, find out how she is feeling. So this is the main point that you want to know how to start this kind of thing. Otherwise, it's simple. Good morning. My name is Bhupesh and I am a nurse. First of all, I would like to confirm your name. Are you Mrs. Maria? Yes, nurse, I am Mrs. Maria. Okay, Mrs. Maria. So I have been sent by your doctor and I have come to know that you are having mild COPD, which recently had a flare up. So you were given an oxygen cylinder for short burst therapy at home. Am I right? Yes, nurse, you are right. Okay. So I would like to know, how are you feeling and how are you coping with the oxygen therapy? Is it working well for you? Oh, yes, nurse, it's working well, and everything is fine. Then you will go according to your task. Okay. So she's feeling normal. So she will tell you some reasons. Drying the mucous membrane in the respiratory tract and suggest solutions, keeping hydrated. Okay. So means अब आपको इस task से पता लग जाना चाहिए. Patient would be complaining that she is having, dryness and then, you know, don't know what to do. So आप कहोगे, see, I would like to reassure you that this feeling is absolutely normal. And the reason for this feeling is that when you use the oxygen therapy, it causes the drying of the mucous membrane in the respiratory tract. So what you can do to avoid this dryness is that you can use solutions and keep it hydrated. So hydration will make you feel better. So you will not feel any dryness if you will do if you will take proper hydration. Okay, nurse, that's fine. Okay. Um, and do you have any other side effects like headache, or are you feeling confused after using this? तो वो बता देगी आपको, तो आपको, और उसके अलावा आपको क्या दिया हुआ है? Kindly use moisturizing cream to help. Knows about the option of nasal prongs rather than a mask, so you can use the nasal prongs rather than a mask. तो ये सब पेशेंट आपको बताएगा. अगर हम इसके पूरे टास्क को देखें, इट्स जस्ट गोना टेक अ सेकंड. आई एम जस्ट गोना टेक इट फ्रॉम आवर मेंटर्स ग्रुप, बिकॉज आपको थोड़ी सी कंफ्यूजन कहाँ पे होती है, क्योंकि पेशेंट की बात नहीं पता होती, लेकिन एक्चुअल में पेशेंट को भी आपकी तरह प्रॉपर वैसा ही टास्क दिया होता है. सो आई एम जस्ट गोना पिक अप द टास्क and we'll try to send it right away. Just a second, I'm gonna airdrop it. It's gonna take a second. Yeah. Okay. So I hope the screen is visible to you all. And if it is not visible, you can write it in the chat box. If it is visible, then please let me know. Is it visible, guys? I'm just opening the chat box. If you can let me know that this new task is visible to you all. Yes. Okay. So I've got it in the chat box. Thank you. So patient will say, so this is the task that is given to patient. So we'll say, yeah, overall I feel better, but my throat feels a bit of dry and sore. So that is where you will say this kind of feeling is normal, and this happens due to the drying of the mucous membrane. So you can use this. Then patient will say, you have not. So you will ask, are there any headaches? No. Patient will say no, there has not been any headaches or feeling confused. I feel the mask is a bit uncomfortable, sometimes irritates the skin underneath. So in that case, you will say, oh, I understand that. It does happen when you are using the mask. So what I can suggest, you can use the moisturizing cream. It will help to prevent, kind of irritation. It can help to prevent irritation. And also there is option of nasal prongs as well. So rather than masks, nasal prongs can be used, which helps to get you the oxygen through the nose. Okay. So tell the nurse that you will try some moisturizing cream before changing to nasal prongs. तो वो कहोगे okay, so I will see nurse. I'm not feeling too good. So after listening to this, I don't want to use nasal prongs. So I'm better with the mask. So first of all, I would like to use the moisturizing cream. तो कहोगे I appreciate your decision that you are choosing to moisturize. So that is not a problem. So otherwise nasal prongs are also very safe. So there is nothing to worry in both the things. Okay. तो वो पेशेंट कहेगा ओके से दैट यू स्टॉप स्मोकिंग अ ईयर अगो और फिर आपसे पूछेगा चेक दैट द पेशेंट नो लॉन्गर स्मोक्स सो ऑल्सो डॉक्टर हैज आस्क्ड मी टू आस्क यू वन मोर क्वेश्चन मे आई यस नर्स सो आर यू स्मोकिंग at all, like are you smoking anymore, like are you still smoking, ask if she has any remaining concerns. So फिर patient कहेगा no, I stopped smoking a year ago and you have been having some trouble sleep, but I am having some trouble in speaking. So you sometimes take one of your partner's sleeping pills to help. So I'm taking bit of sleeping pills as my partner takes sleeping pills, so I'm unable to sleep. तो फिर वो आप कहोगे see this can happen due to stress, please avoid sleeping tablets as it can slow down your breathing rate. So please you can do yoga or meditation that can help you to relieve your stress. So please do not take sleeping pills. तो अब अगर आपको मेरे को ये टास्क पूरा बताना है तो अब मैं आपको दोबारा पूरा बोल के बताता हूँ. बिल्कुल सिंपल. Okay, so I will try to write it down somewhere because this is the writing we did here today. So I'm just going to write. So good morning. My name is PKM and I am a nurse. First of all, I would like to confirm your name. So this is what you do. Confirm, not inform. Sorry, forgive my typing. First of all, I would like to. First of all, I would like to confirm your name. Are you Mrs. Maria? Are you Mrs. Maria? So she will say, obviously, अगर आप नाम बोलोगे तो वो हाँ ही बोलेगी पक्का. Yes, nurse, my name is Mrs. Maria. Oh, Mrs. Maria, that's good to see you. So main line. So I have been sent. This is a passive voice. This will give you marks. I have been sent by your doctor. फिर कहानी को बताओ पूरा. As he told that you are a case of mild COPD. इससे आपकी मतलब बेटर होता है. आप पेशेंट पे ट्रस्ट बना पाते हो. You are having mild COPD, but recently you had a flare up, so that's why doctor advised you to take oxygen therapy. Am I right? बस ये बोलना है. Am I right? तो बोलेगी इससे कनेक्शन बनते हैं. Yes, nurse, you are right. So I would like to know how are you feeling now after using the oxygen therapy? And are you feeling any better? Yes, nurse, my breathing is all good. Everything is smooth and easy, but I am having some kind of dryness in my throat and there is some soreness. Oh, that's common after using oxygen therapy. So for this, you can use moisturizing creams, or also there is an option of nasal prongs. So in this, you can take the oxygen through your nose with the help of nasal prongs. Oh nurse, that doesn't sound really nice to take the oxygen from the nose. I think I would have little problems, so I will try to use the moisturizer first. Oh, that's great. That's great. And I appreciate your decision. And at the same time, अगर ये गलत चीज नहीं है nasal prongs, at the same time I would like to tell you that nasal prongs are also very comfortable and there is nothing to worry. But for now you can use the moisturizer. That is not a problem. Okay, nurse, is there anything else that you would like to tell me? Are you feeling any kind of headache or confusion? No, nurse, there is nothing headache, nothing, no confusions at all. Everything is fine and smooth. I'm not having any kind of problem. But yes, I'm having this. ये तो हो गए point हमारे. So I'm not having any problem. Okay, that's good to know. So I would like to ask you that are you still smoking, or have you given up smoking completely? Well, nurse, I gave up smoking a year ago and till now I'm not smoking at all. That is आप कह सकते हो, that is very good to know that you are taking care of your health in the best possible way and you are not smoking anymore. Are there any other concerns that you have? Then patient will say, yes, I'm having sleeping problem. So you can say, see, this can happen due to stress. Stress is one of the reasons that can lead to having sleepless nights. But sleeping tablets is not the right solution because it can lead to dependency. So please avoid these sleeping pills. Rather, you can have other alternatives like yoga and meditation, or you can pursue some of your hobbies. If you are, suppose if you are a book reader, or if you are kind of a person who likes singing or likes to go for physical activities, so please try to indulge in those activities. It will help in kind of distraction from these stress. Is it okay? As these sleeping tablets can cause slowness of breathing. Okay, nurse, I will take care. Well, that's great. So is there anything else that you would like to know? Well, no, nurse. Okay. So I hope you have yeah, this is the most important line to end up the task. इसके बिना task खत्म नहीं होगा. I hope you have understood everything, and I would like to highlight the key points that after the usage of oxygen therapy, yeah, during the usage of oxygen therapy, it is common to have this throat or this. It is pretty common, so there is nothing to worry. And also that you should avoid the sleeping pills, and moisturizer can be used so as to avoid the dryness or irritation around this thing. Okay, so I hope you have understood everything. Here is a leaflet which contains all this information about oxygen therapy and other important points about oxygen therapy. So please go through this leaflet. If you will still have any doubt, there is my contact number as well on the leaflet. You can contact us anytime. Take care. That's it. That is how you close it down. So basically, that is how the speaking goes. And this is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967342256. Thank you.